Hi. So I don't do YouTube videos or anything like that, but I take Humira, and I know it can be really scary giving yourself an injection, and so the reason I wanted to make this video is because when I got started to ease my nerves, I watched a lot of YouTube videos of other people, doing it on themselves and just seeing other people do it in real life and not just reading the pamphlets that come with the pen. So a couple things just to quickly give you a idea. Well, I've been on Humira about 8 months-ish, and I take it for a condition called uveitis, which is an autoimmune disorder that affects my eyes and my vision. I've actually lost vision in my eye as a result on my right eye when I was 18, and luckily since then, now that I'm almost 30, I found a really good doctor in Houston at the Houston Eye Associates. She's wonderful. She knows everything, and she has helped me save my left eye now for 10 years. So, or pretty close, like 8. But, so she works miracles. I don't see a lot of videos of people that have uveitis. So if there's any more of you out there, you're not alone. And me too. So a couple things before we get into the pen. The manufacturer AbbVie, ABBVIE, actually has a service where they will send you a test pen, and it was really crucial in my being able to do this. I get extremely nervous every single time. Yeah, you'll see, but I'm actually going to do it with you here. But one, I just wanted to show you a couple of cool things. One is this test pen that I got. It's a cool little booklet. It actually comes with a pretend pen, and it actually has, I don't know if you can see that there, it's got a play button, rewind, pause. It will walk you through, and the first few times, actually, I had my boyfriend sitting next to me doing the play pen, so it could count out 10 seconds, tell me what to do step by step. Since then, I've gone with my doctor, found a few tweaks that we've had to make. But this is a really cool tool to have. It's got all the booklets that you need, English and Spanish, and can help you through. Also, they will send you a travel kit with ice packs, a little zipper bag. I also got the syringe disposal, beautiful little red biodegradable bucket full of syringes. So I feel like a druggie every 2 weeks I feel like a druggie. I pull out my syringes, pop my needles, whatever. But yeah, so the Humira actually comes in a box. I do it every 2 weeks, and each box has 2 pens, so each month I get a box with 2 of these. It comes with the same user information, whatever, safety stuff. It comes with the alcohol swabs, which I love. These are awesome. And yeah, individually packaged, so super. Before we start, I just want to say that I'm not a doctor at all. I can't advise you on any medical stuff. If you have any adverse effects, obviously talk with your doctor. Don't do the injection before doing it with your doctor or going over it very detailed with your doctor. There's also a nurse helpline that can help you, and most people's insurance has the same thing. But yeah, so let's get started. I'm already nervous, as you can tell. Just set down my alcohol swab. First thing I do is take this out of the package, and there's the trash right there. I mentioned I have an eye disorder, so I am not 30 yet, and I wear reading glasses. First thing you want to do is check. I'm going to check the window. There's 2 little windows on each side. Hold it up to the light. Make sure you don't see anything hazy, floaty. Make sure it's 2 when the gray pen is up, make sure everything goes to the fill line, and you're good there. A couple helpful tips. I like to turn on the TV usually and watch it for 10 seconds, and then it's like it never happened. That's really helped me. When my boyfriend likes to sit with me, and I used to want him to sit with me all the time, he freaks me out because I can tell he's nervous, and it weirds me out. So just FYI, you can also have a friend do it. I don't trust people that much that are not medical professionals. So I'd rather do it myself. If you want it done right, you gotta do it yourself, right? So yeah, so you want to wear shorts, or usually I'm in my pajamas with my pants down, whatever. Okay. First thing you want to do, the caps are numbered. There's a gray cap and a red cap. Gray cap is number 1, and you want to rip that off. Okay, it exposes the little sleeve that holds the needle. Don't touch it. Don't do anything like that. Oh shit, shoes. Skipped a step. Sanitary reasons. First things you want to do, obviously I already did, is wash my hands and just, try and be really clean. Second, get this little alcohol swab and just clean the whole area. I'm not picky about the area. I was for the longest time. It freaked me out, and I would sit there for like 10 minutes hyperventilating. So, okay, 2. We're off the red cap. You want to do it now straight up. Don't want to yank it to the side. You don't want to bend any of this goodness. So what's going to help you see, or get rid of arthritis or whatever else you take it for. Now the instructions will tell you to pinch an area of skin. In my experience, my doctor told me not to do that. When I do, it hurts more to pinch the skin. Like, I always freak out, I'm going to hit muscle, and I think if I pull the skin away, it hurts more. And I think it's because I'm pinching it and putting pressure there, I'm constricting blood flow, I don't know. Everything's going wrong. So, and it actually hurts more. My doctor actually told me just to put it smooth on the skin, push it to where the whole sleeve is compressed into the skin. This needle is so thin and so short, it's not going to puncture any veins, it's not going to puncture any muscle, it's barely going to get through your skin. That's why it's so crucial to get it all the way down. If any medicine is spilling out, it's very expensive. Without insurance, you'd be paying $3,000 for one of these pens, or for 2 of these pens, I guess, for a month. You don't want to waste that kind of money. Luckily, I have insurance. And there's also a assistance program that's really helpful. I do that myself. It's, saved my life, honestly. Okay, so enough stalling. As you can tell, I do that all the time. Here we go. Okay, so what I like to do first is just kind of put my hand around the area so that I can see what I'm doing. And I know you can't see really what I'm doing. Face the pen towards you, or excuse me, the window. You can see what's going on. And then push that all the way down. Okay, now you can see there, you can't see any of the white sleeve. That's what you're looking for. Okay, this is the part where I have to coach myself and just take some deep breaths. I'm going to look up at my TV for a minute, and you're not going to hear me talking. Excuse me one moment, okay? And done. That's it. Oh my God. So, a couple things I did mention. One, when you hold it down, you're going to have a tendency to pull it back up. Don't try your very, very best to hold it all the way down. And keep the plunger pushed all the way down as well. It's going to make sure the medicine goes in and doesn't come out any slower. You want it to go as fast as possible, I promise you. Okay? The popping is the loudest part, so it says not to cap these. I'm just going to stick this over the top. Don't want to risk touching any needles. And that is it. So properly dispose of that in the receptacle that I received. And it's just a cute little thing right here. I like to go needle first, obviously. And press that screw cap on, you're good to go. So as far as symptoms, Obviously, it stings, it burns a little bit going in. It's not too bad. The loud click, and then hearing the bubbles or whatever, the medicine whizzing in, you can hear it. That I think is what weirds most people out the most. There is a little tiny speck of blood that comes out, nothing bad. If you have diabetes, you probably would see more than that. But yeah, every once in a while I get some bruising. Honestly, since I've been doing it full on without the pinching, I've not had any bruising. I've only been doing that about a month, but still. Also, I got a tip from actually a girl I work with. I think she used to work in a medical office. I don't know. But she has like a biology degree, so I trust her with my life. So she suggested putting a heating pad. What that would do is just kind of keep your skin warm, keep the blood flow going, help keep you from getting bruising. Don't put it on too long, obviously. I wouldn't put it on immediately after, when you heat up the medicine. It is stored in the refrigerator, so obviously it's meant to stay cold. I take mine out of the fridge about 30-ish minutes before I do my injection, just because my refrigerator is a lot colder. And I keep it in the deli drawer too, which is like 33 degrees, or 34. So it's basically frozen. And I don't want that going in my skin. That sounds really horrible. And I think that's what the heat or the stinging, it's just a temperature change. That's all it is. Nothing to worry about usually. Obviously, like I said, if you have any weird symptoms, if you have raised bumps, peeling skin, any of the stuff that's discussed in the pamphlets, obviously call your doctor. If you're concerned about it, call your doctor. The website has lots of information. I love drugs.com, WebMD, Mayo Clinic is my favorite. They all have really good information. And symptom checkers, drug interaction calculators to help you know anything that could go wrong, anything to look out for. I'm kind of a hypochondriac, or like I like to call it, an avid researcher of medical symptoms that I may or may not experience. So yeah, that's it. That's my Humira. You can see nothing. This is the injection right here. You see a little blood dot. I don't like to touch it. It's a little tender right now, and it'll be tender for about an hour or so, but I'm getting ready to go to bed, so I'll fall asleep, forget about it, and wake up tomorrow. Vision clear. Okay, well that's all. Sorry if I rambled, and thanks. Like I said, first timer, and I'm really bad at making videos, and yeah, but if this helps one person, makes one person feel comfortable, like others' videos, really helped me have the confidence to do this injection. As nervous as I get, I seriously have anxiety about it every week, and it's Humira Day, it's like D-Day every 2 weeks. So yeah, if I can do it, you can. Find a doctor you trust, and yeah. See you later. Thanks for watching. Bye.